All of the vaccine is actually allocated and distributed by New York State. Vaccine comes from a federal supply, which is distributed to the states, and then the states determine how to allocate that out to the counties and hospitals and any provider's office that is available to have vaccine. We're required to follow New York State guidelines for vaccine allocation, and it's very specific related to whatever entity you are, whether you're a local health department or a hospital or a pharmacy. That determines what group we get to vaccinate. And so when we get our allocation, we're actually given the directive as to who we can use that allocation for and whom we can vaccinate.
Our first clinic here was January 18th, and since then we've vaccinated about 500 people through this clinic. We've received allocations the first week for 1B, which included 65 plus and essential workers. After that, it was all for 1B essential workers. So we have reached out directly to employers, school districts, the jail, corrections officers, child care people. We want to register people through their employer so that way we know we can certify and validate these people are essential employees. Otherwise, if people come to the clinic that aren't certified or validated to receive this vaccine, it's a problem because we are audited by the state who gets that vaccine.
Vaccine is in such short and limited supply throughout the state that there's just a very limited amount that's being trickled out to counties and entities that are receiving that. So at this point in time, we don't have enough vaccine for live public links. We have to actually utilize that essential list, and we have to do that legitimately because there is a check and balance. It is federally and state tracked. Regarding pharmacy or Walgreens distribution, that is all done via New York State. We don't have control over that allocation. Hospitals also receive their allocation through New York State. They've had sporadic, so sometimes they receive the vaccine, sometimes they do not, depending on what type of allocation is required that week for the state. And again, it's back to the distribution of vaccine throughout the entire state of New York. So with the federal supply coming to the state, depending on what that is, then the state determines who gets the vaccine for that week and how much. At the county level, we would like to see as many people vaccinated as possible. The county, nor does the health department, have control over how much vaccine comes into the counties. The state really has to make that determination based on how much the federal government gives to the state. So really, the state is the one making the determination and splitting that out within these areas. We don't have at the county level any control over that.
Those state mass sites are allowed to pre-book. We're not allowed to pre-book any appointments. The hospitals aren't allowed to pre-book. We can only book as we get vaccine. So every week we find out how much vaccine we get. From there, we have to plan our clinic accordingly. Those mass sites can pre-book. They take the first part of the allotment and then they dole it out accordingly across the state after they have supplied their mass sites.
What we'd like to do is, now that we've had a few weeks of more consistent, limited supply of vaccine, but we know we're getting some, is to try to provide a weekly update as to what is going on. The biggest challenge for us is that information is distributed on a weekly basis, and some of the guidelines do change, and the allocations change, and we have to adjust in a very short time frame. And we also have to be able to distribute it in a very short time frame because it is a week-to-week allocation, which we must utilize in order to receive future vaccine. And we want to continue to get as much vaccine into this county as we can, at least through the health department for our clinics, so we can just continue to keep trying to vaccinate as many people as are eligible.